It's Ergo Summit. We're really happy to have you here for identifying risk made easy with 3D AI motion capture. But before we get started, you've probably heard this before, but my contact information is in the chat. So if you have any questions about the summit or you just want to reach out and connect, please feel free to use that. Also, we do have a QR code for you to scan in the bottom left, as well as I will toss the link in the chat. So let us know if you're having a problem scanning that, and we can help with that. Also, I want to say a big thank you to 3Motion AI for being a sponsor of the Ergo Summit. Again, I've said before, we're only able to do this summit and keep it free because of our sponsors. So thank you, big thank you to 3Motion AI. Now, I want to introduce Lisa. Lisa is a recognized leader in health and safety with expertise in using advanced technologies like 3D motion capture and AI-driven ergonomic assessments. Lisa is a nationally certified occupational therapist and certified occupational health practitioner. She has successfully implemented solutions that enhance both workplace safety and business performance. Lisa's strategic approach helps organizations protect their employees while driving long-term success. Having said that, I will stop talking now, and Lisa, the stage is all yours.
Thank you so much, Dan. It's really our pleasure to join you for the Safety Nights Virtual Summit, as well as to be a sponsor. So I'm joining you here from Chicago. I'll tell you a bit about 3Motion AI. They're a Toronto-based company, and I have the honor of representing our team here today. Our PhD prepared innovation and engineering teams are relentless in their commitment to research-based innovation and accuracy. They work hard, and we all play a little bit harder. So a shout out to Dr. Alora Brenneman Wilson this week for her competition in internationals. Our CEO, Reed Hanoun, has dedicated a career and had dozens of patents as well as 4 successful tech launches prior to really focusing on harnessing and developing 3D AI motion capture prior to many of our competitors. We started refining this technology in 2019 to really create a technology that improves health and allows everyday health and safety people like you and I to identify risk. As a Chicago-based OT, I have used Reed's technologies throughout the course of my practice. The 3 things I'd like you to take away today are basically, one, just what is 3D AI motion capture, then why early risk detection matters, and how you can really make a difference on the front line. Why is it important for us to recognize when either a workstation is not moving correctly or perhaps an employee is having difficulty, so we can then action early intervention. So let's dive into the technology. I saw this quote recently, and I just want to start with this. A lot of ergonomists and people that do, let's say, safety assessment think that AI is going to take their job. AI in itself won't take your job, but somebody using AI will. And I'm just going to pause and let that sink in. That's something I read and I sat with for a few minutes, right? Because why is it important? Like, what's the so what of this technology? So let's dive into that. So when we look at the direct workplace injury costs, and this is for North America, the human and the economic cost of workplace injuries is staggering. And we look at these numbers, they're in the billions of dollars, right? But attached to those billions of dollars are people who have real-time life impacts as well. So when we look at that, the cost of workplace injuries coming in at about 167 billion annually, just wage loss and productivity at 50.7 billion, medical expenses at 37.6 billion, and time lost by workers and administrative tasks. It's replacement costs to put someone else in their place or to hire a new employees at 70 million. And these stats are from the National Safety Council data. But what I want to take away from this, the cost per worker annually is about $1,000. And the average cost they're putting on a medically consulted workplace injury is $40,000. So a lot of times people are like, oh, AI might be too expensive. How can I implement this? What we're going to be showing you today is how you can simply implement it and what we have coming forward that will help democratize access to this technology. So one of the challenges we face is the traditional approach of the identification of risk, enhancing performance and managing injuries, as well as looking at prevention. So very often we rely on manual reporting. We've all been there with a clipboard and the paper forms and the JHAs that need to be filled out. And especially today, sometimes there's more JHAs than we can possibly get to. So with manual reporting, it's cumbersome and it also can be inaccurate. Like you might take the same assessment and have three different people go look at the same task and come back with three very different interpretations. So technology gives us a common baseline of data that we can all work from. When we look at things like new hire training or looking to hire the right employees, physical exams can be inaccurate and it can be subjective from evaluator to evaluator. So we're able to incorporate the same technology to create a common database among folks that we're hiring, and we're able to match that to their work. Additionally, when we first looked at how people move and being able to measure this, we needed to rely on motion sensors and biomechanics labs, which are not portable and they're very expensive. There are a number of motion sensors in the market, right, that have value. There are motion sensors now that monitor our environment, have all different sorts of functions. There's definitely a place in certain situations for motion sensors, but when it comes to evaluating motion, we can now simply do this with the camera and we can bypass the need for any type of marker or sensor that a person needs to wear. And it can be invasive. I mean, people feel funny about putting them on, and let's face it, we're human, people are working, they get sweaty, sensors slip, so we can run into a lot of inaccuracies that way. But overall, as we look at what defining the problem, organizations struggle to identify tasks that cause the greatest health and safety risk to their employees, or they know the problem and they're not able to solve it immediately. So once they find the solution, they also have difficulty sharing best practices across multiple facilities. What our solution offers is the ability to really illuminate ergonomic and musculoskeletal health risk, allowing for proactive interventions. So what we're doing is providing you with a simple tool that allows you to illuminate that risk at the task, employee, occupation, and also an enterprise level to really generate change and get results. So 3Motion AI flags performance indicators that might otherwise be hidden. Even as somebody who's experienced in the occupational health field, I might go out and expect to see something when in fact I should be looking objectively every time I go into a situation. So what I like about the technology is sometimes I'll look at things and it will reveal things I hadn't thought of or hadn't anticipated. So what you can simply do is with your phone, you can hold it up, and what it will do is we call it sort of flashing the scenario, but it will play in real time and highlight any injury risks in terms of the body parts overall, the arms, legs, and trunk, and give you a sense of where those risky areas are. So for example, if you're walking through a work area, you're able to use this to check out maybe a new workstation setup or a new process that went into place to see if any of the movements of the employees are flagging at a higher level that perhaps those workstations need to be adjusted. Likewise, as you're going through, you may see someone who's moving in a risky way, but the job doesn't necessarily call for it. And so that's always an opportunity to identify for training. But as you scan this person in real time with flashlight, it creates a single risk score. And that single risk score will give you an idea of the level of risk in terms of how the person is doing their job overall. And then it will feed up into a predictive dashboard. So within the dashboard, you'll be able to action the portal and be able to access reports as well. Now, all this, when you do an assessment, probably takes about 3 minutes. So when we think about the time it takes to get out to a work area to do an assessment, think about how often or how long you're spending on ergonomic assessments today. Even if people want to put that in the chat, give us a sense of how long it takes you to go through and do an ergonomic assessment for a single workstation. Now what you're able to do is take the flashlight out, do videos of each of the tasks, and have instant results that you can share with employees, and then also later share with the team in more detail. How it works is we take a computer vision layer and we digitize 19 skeletal points, which creates a 2D image. Now, you may see this a lot on the internet, right? Where they're just, putting skeletons on people as they're moving and assigning risk scores to that. What we do once this computer vision layer is assigned is we pass this through our proprietary AI, and it gives us a true 3D conversion with excellent accuracy in terms of how people move. So what we do in the machine learning layer is we attribute 53 skeletal points to the individual, and it creates a virtual avatar that you can then analyze from the top, from the bottom, the side, really from any angle where the person is in any position. And then with our advanced analytics layer, this is where we apply things like the NIOSH and the REBA and different ergonomic assessments that feed into our overall performance score for that ergonomic risk for that particular task. Now, what we're excited about, and we mentioned democratizing access to our innovation, is with Flashlight. If you sign up today, and there will be a QR code that they posted, we will put you on the list for the release of Flashlight. And what we're doing is when people download Flashlight, you will be able to use this in real time to identify risk in your workplace. We'll be talking in a few minutes more about the use case for that. But what it will do in real time is it will show you in red, yellow, and green where the risks are for that employee. And what is powering that in the background is our deep analytics that I've just talked about. And thank you. Thank you, Matt. I just saw your comment. Okay. So with the single score, it's interesting. When we started, we really went with a more complex report, and our users came back and said, really, I just need the single score. I don't need the full report each time. So when you're measuring someone, you're going to get that real-time risk score, and then in the app, be able to see both the summary and the video view. So let's say you're walking through a workstation and you're trying to convince some of the higher ups that you need to make a change to that workstation or need a deeper ergonomic assessment. You're able to analyze that job, show that real-time injury risk, and discuss that in real time with the worker and with the folks that you're with. Now, if you just wanted to coach the worker, for example, and then take a reassessment, you can also do that in real time and share with them from a coaching perspective how they're moving. All this data feeds up into an interactive dashboard. So it gives you data in terms of each assessment, how many assessments were done. We're able to assign this by location. So while data may feed up into your organization as a whole, you may have individual locations that you assign your EHS professionals to, or even like frontline supervisors or trainers to collect data and really have more boots on the ground that are looking out for risk in your organization. What you're able to access from the dashboard are the comprehensive performance risk scores that will drive those decisions in terms of where the focus is. If you know, for example, that there's been a lot of reports of shoulder fatigue lately in a particular area, you can target that area to do assessments and look at ways to either make changes to the work area or perhaps put administrative controls in place that would assist in reducing that fatigue. So when you've identified an area that needs a further advanced analysis, like a full NIOSH, a full REBA, one of the things about 3Motion is that we're continually adding assessments. So with our new report, what you'll be able to see here is you'll be able to see which assessments are activated for a particular area. So what you're getting in the report with the full assessment and overlay is you're getting an overall ergonomic risk score that's split out into upper and lower body. And what we've been able to do is we've been able to separate our scores. So for example, if you have someone working within like a lift truck and you can't see the bottom half of their body, it will just evaluate the upper half or what it will see, right? And so in this report, there's many factors that feed up into this risk score. It includes the overall amount of time the person spends with their shoulders, elbows, wrists, low back, and knees in various positions based on their range of motion and based on the time spent in those particular postures, as it flags high risk postures as well. It's giving you a reach envelope that gives you a sense, this is based on Liberty Mutual in terms of height and the Canadian Standards Association for forward and lateral reach in terms of where that person is with their reach envelope as well as their hand height. So here it's going to give you the percentage of time they're above shoulder in their power zone or floor, basically knuckle to floor in that percentage. And then what we do is dive deeper into particular low back angles, including with the NIOSH, for example. We measure torque. So you're able to look at the back compression scores that are calculated by NIOSH, as well as shoulder moment and back moment scores that look at the overall torque through the joints. Something that human resources professionals find helpful also is this percentage of time in various postures so that they can match that to potential restrictions when someone is coming back to work. So we're very excited to share with you our video overlay. And at the end of this presentation, we'll be able to play this video live. So as this individual is working, this square will light up in red, yellow, or green based on what their overall score is. And this bar here, which is more or less a gauge, will show you in real time where that red, yellow, and green scoring is. Inputs that we have that are very important to our assessments include hand load, which is entering the weight of the object, what the frequency, and what the duration of the task is. So you're able to look at the task, whether it's a one-time situation or whether it's something that you will extrapolate over an 8-hour day. Now, as this person is moving, all the hot zones will also pop up here on the avatar. So this is a great example where, oh, this is moderate risk, this person is in yellow, but here what it's picking up in red is it's picking up spinal rotation and this elongated reach with the box that's putting them at risk, in this part of the back. So it seems like a lot of detail, and it's really putting a powerful observation tool in your hands to give you real-time data. That data then feeds up into a web portal where you're able to sort things, by job task, by body part, and take a look at where those areas are so you can set targets to reduce those reds to yellows and those yellows to greens so that we have all the workstations properly set up from an ergonomic perspective and also identify areas for training. I don't know how many people have experienced it. You could do a show of hands or put a comment in, but we can create the perfect workstation and people will find ways to skirt around actually using it in the way it was intended. And sometimes that's on the individual and sometimes it's on the fact that perhaps they weren't trained how to use it. So it identifies that opportunity to really get in and to work with them. So what do we do with all this data? I mean, data for data's sake is data. But as we take these videos and we look to action these assessments, what we're using this for is real-time risk decision detection that we can then look at training and education, critical physical task risk evaluations of those jobs, and even looking at like pre-employment standard developing. So what some folks will do is go through and take videos of different tasks, create best practices, and say create libraries for new hires to come in. And this addresses, some of the gaps in our field, some of what we're losing as the largest generation of people are retiring is we're losing that legacy knowledge, right? And so this is a way to capture best practices and capture work techniques that can be shared ongoingly with people in the future. And with that, what is the power of a single observation? So even for someone like myself, who's, oh my gosh, I've been in thousands of companies, boots on the ground, seen thousands of job tasks, but the people that are coming in today don't have the same opportunity to work with large groups of people in training. So this allows us to be able to pass on through algorithms, through, various AI observations and techniques to be able to share that knowledge and that observation of what was typically done by just one person who was trained in observing that. Other ways we action that data is we look into task-specific injury prevention programming, real-time injury mitigation, return to work assessments, and rehab and recovery. this is a passion of mine in terms of looking at early risk identification and mitigation. And I'm so pleased to share this with you today because this is how we care for our family. So as in, I'm a mother of three adult children. My husband is a retired fire captain and safety person. So there are robust discussions about health and safety that go on in our house. And how we take care of that is if someone gets hurt, like, that happens, whether it's a sports injury or, they slip on something, or we just notice someone's not moving well, we go in for early intervention. And I think sometimes people are not aware that that's an option, not only through on-site resources at work, but near-site resources that are available through insurance or HR, and also now the many virtual options there are to have intervention around staying healthy. So as we look at flashing risk and early risk identification, what we want to do is identify high-risk movements in job design via that flash capture, or high-risk movements in work task performance. And so what this does is this gives you a trained eye to look through this lens and to be able to see how that person is performing at the workstation and how that person is performing overall. What we want to do is detect potentially abnormal movement patterns. So what is that? AI can detect subtle changes in movement that might suggest pain or fatigue in injuries or potential injury in workers, allowing for early identification and prevention of musculoskeletal disorders. So, for example, you may have someone that you did a walkthrough in the morning and you did some workstation assessments. They scored great. And then later in the afternoon, you went back to recheck something, and now all of a sudden they're yellow, they're not moving as well. Could be an indication of fatigue, perhaps an indicator that, hey, this might be someplace where we could implement job rotation or implement pre-work stretching or job coaching, even in terms of biomechanics for that person. Or it could also be an issue with how the machines and tasks run at that time of day. So it really gives you an opportunity to open that dialogue. So if you're going through and you speak to someone, you explain you're doing an assessment, you do that assessment, it gives you a chance to engage them. And the videos really do engage the employees. Like, they love to see their own data, and they love to see, be able to actively be involved in that problem solving to reduce the overall risk. And what that data does is it allows you to triage to really prevent injury and promote wellness. So that might be the clue that, oh, I did a walkthrough and I want to engage my ergonomics team. Oh, if I don't have an ergonomics team, do I have a resource through my insurance company, or do I have a single resource that I can call? So 3Motion AI has several integrative partners that use our technology, that come on site and work with employers to do assessments and also help them to action solutions. So that's something we can most definitely help you with. And if you have the good fortune to attend it, Matt Weber will be doing a presentation from Cardinus. And Cardinus is a partner of 3Motion, or 3Motion AI is a partner of Cardinus in the Global Ergo Alliance, which he'll be talking about, I believe, upcoming in the summit. So as we engage ergonomic teams or preventive care triage to promote musculoskeletal health, we then get an early intervention response. So sometimes, but a third of my career, I worked with employers in putting these early intervention first aid clinics on site. And what we found is when people had a complaint, they came to you with a complaint of fatigue or discomfort, that generally they could be seen within 1 to 3 preventive care visits and resolve those injuries on average. And this is over the course of a 10-year period, seeing thousands of employees that really came out to close to a 10-to-1 return on investment for just one employer, although we did that across several employers. But what's always been very siloed is the way we look at work injury and fatigue and the way we look at our personal health. And so I encourage you to look at how people are moving holistically, both at work and at home, because now our lives are very different, right? Like, we work and then we go home, and many people spend a lot of time on their screens and screen time, which is creating a lot of forward posture, a lot of flattened curves in the spine that lead to additional fatigue and also impact their recovery from the workday. So when we look at these concepts of triaging and preventing injury to promote wellness, it could be an on-site resource. It could be an external provider that the person sees. It could be as simple as looking at your jobs as a whole and providing exercise programs that are available to your entire workforce. So there are many ways to intervene and act on the knowledge and data that you're collecting. So when we talk about early intervention triage, it's defined by OSHA in terms of first aid. So if a person has a symptomatic complaint, they see a provider, and this is for diagnostic care only. And they may be provided, as I mentioned, if there are already existing exercises, those may be made available to them. And then ice, heat, education can be used to resolve a lot of injuries. And sometimes, it's just giving folks the permission to make it a priority to take care of themselves. Um, the early intervention triage is a comprehensive approach in managing total worker health. So now, you're in safety, but also working with the folks in HR and really bridging that gap between um, the types of fatigues or physical problems that might not be work related. Like, let's say it's hunting season and a lot of people in your company go hunting and everybody comes in and they're fatigued. All of a sudden they're coming and working fatigued. They're not moving well, right? But they're at work and something happens and then that becomes a workplace injury. So it's really looking at promoting the total health of the employee overall in order to drive the incident rates down. So early intervention really aims to detect musculoskeletal issues at a very early stage, so we lessen the overall effect. The early identification of those movement abnormalities and early reporting can prevent injuries. And this was something that really caught my attention at one of the recent NSC conferences in a presentation. So just by observing, just by using a tool, just by engaging with someone, could you save their life? That's something, a question in many years I had not asked myself. But the statistic that was presented at this conference, which I will share with you, is that 15% of all construction workers in the U.S. have substance abuse disorders, compared to 8.6% of the general population, and represents 25% of the fatal opioid overdoses, which I know is a topic of presentation in this virtual summit this week as well. So it's 163 deaths per 100,000 workers, and that I found from an updated stat from the CDC, like shocking. So you have to sit back and think, how is it related? Well, people are working, they're using their bodies, they're having discomfort, they're going through traditional medical care and being prescribed medications, in some case opioids, that are very addictive. And what happens is, um, as people get addicted, eventually they stop prescribing the opioids and they turn to other methods of, really resolving their pain. And that could lead to substance abuse, whether that's alcohol abuse, drug abuse, whatever that may be. And so if you're noticing someone's not moving well and you open that dialogue, it may be the opportunity just at that point to get them the help they need. There's one case I remember, and it was quite a while ago when opioid cases, first came to be. And I was doing an assessment, and this individual couldn't move. And their vitals indicated that they were under the influence, and we had to stop the assessment. And we were able to actually work with their employer to put them in a substance abuse program and bring them back later where they were able to pass and return to work. And so it's important to recognize if people aren't moving well, but also sometimes to ask them why. And it could be a personal reason. They may not discuss it with you, but you still may be able to refer them to HR. Or on the flip side of that, when it comes to workstation setup, when I'm watching someone work and I'm seeing something that's high risk, once they're done and there's a natural break in activity, I like to ask them why. Like, why are you doing this way? And sometimes there is a process reason behind it. Sometimes it's because, let's say they were trained that way and it's just the way they've always done it. But getting to that why to help them then action that changes is so important. And you're able to show them real evidence. Like, here, when you move this way, this is what your risk score is. Let's try moving this other way. Or what other way do you think you could move? And you're going to be able to see real time impact in terms of the overall change of that. So early intervention triage focuses on identifying and addressing those symptomatic complaints before they become an injury or claim. And that's my preference for reporting that. I know everybody's worried about recordables. It's really up to companies to make the decision on recordability. But if we can get folks in early intervention triage, resolve those symptoms, and they don't go on to become an injury or a claim, that will naturally reduce your recordables. So when we're looking at reducing injury rates, we're looking at reducing lost time, we're looking at improved morale, we're looking at increased productivity, reduced turnover, and also positive return on investment. So there have been employers I've worked with who said, oh, we're going to do this because it's absolutely the right thing to do. But by and large, as safety professionals, just like health professionals, we have to be able to show the return on investment for something to be able to implement that change. And so with this, going back to the cost of injuries, if one injury costs $40,000 and you're implementing a change that's a fraction of that, you only have to show that you've saved one injury to really justify the use of that particular solution. And lots of other ways to show ROI too in terms of productivity. I know a lot of companies will do surveys about morale and things of that nature. So many ways to show the benefits of implementing a program using technology, but also using early intervention with technology. So that key benefits of the early risk identification are to be really proactive about musculoskeletal health, leverage the motion capture to identify those high risk movements, understand what the abnormal movement patterns are, and then be able to engage proactive solutions to that. What we're looking to do is reduce the injury rates by identifying those problem activities, and also the problem movements to reduce that risk, which leads to improved worker safety, enhanced productivity, and also an age-resilient workforce. So when you're working on a daily basis, what happens is you're using your muscles, which are causing a small micro trauma to that muscle, which is normal. It's part of work. And when we go home and we rest, how we then heal has to do with how well we sleep and our proper nutrition and how we rest. Our level of stress, our level of mental health, all feeds into how we heal from that workday. And unfortunately, we all lose about 1% to normal aging, and that's what it is. So I know there's a presentation that if you missed it, you can check out in the summit that talks about sleep and sleep hygiene and how important that is to healing and to our health. And I would definitely support that. So to give you some case examples of our technology in action is anywhere that you can take a video, you can take this tool. And so here's an example in the field where typically we connect by either Wi-Fi or data. But if you're in a situation where you cannot safely use Wi-Fi or data, you can also take a video and later upload that into the portal. So in this example, they're looking at potentially just the overall risk of the job, but it can also be used to test different types of tools. Some of the limitations of the technology are, for example, it doesn't measure force. So people say, so can we measure force? No, but we have inputs for weight, at which in turn measures joint force and also measures back compression. So those are physical attributes, but not actually like the force to torque the wrench, for example. And what's important too when you're taking your videos is to capture the individual from top to bottom. And the technology does best when there's contrast between the individual and their work area. Now, something that we have, and because right now this is live assessment, facial blurring is automatic for every single video. And we also have the capacity to blur or black out the background completely, which is important in certain agencies, especially with government agencies and things of that nature. Another use that folks are finding is for training. So as we mentioned earlier, you could take videos of best practices and create a library of those best practices that you might share amongst various locations that have similar processes to yours. It might be to create a library for someone who is new to the job and just training up in terms of best practice and how to do things. Or it could be a refresher for a person who's been out of work for a long time and coming back. What's improved about the technology, and it's been so exciting because over the past 5 or 6 years that I've worked with this, there were longer periods of time between when we were coming out with new features and now with AI and with the uptick in technology, we're seeing those innovations coming much faster. So as we track this individual from head to toe, when they step behind the boxes, you will not be able to see their feet. What the 3D AI will do is make reasonable determinations about where those body parts are to be included as part of the assessment. Where it completely cannot track, we have a quality check that then reduces any outlying data that shouldn't be included for that individual. So one example is we have a large hospital system that purchased over $250,000 in equipment to help learn to transfer patients. And so what they did was they put this up on an iPad on a tripod, and they were able to take the equipment, and the nurses were able to work with the equipment and see their risk in real time and self-adjust their motions so that they were optimizing how they were moving in the green and the yellow zones. Another way you can do that is you're able to cast this up onto a screen, share this during a presentation, or download and share the videos on an intranet or amongst your team. Another way that our providers use this is really in recovery. So we offer virtual screening options where employees can set up the technology and do a virtual motion screening. We have another way that we deliver data in terms of a skeletal overlay that's often used by health professionals and looking at things like core stability, looking at gait patterns and overall motion. And so the technology is used in the healthcare space, also in medical and claims management, and for advanced reporting. For those who may be familiar with our socials and also our website, 3Motion AI also has deep roots in the sporting industry. We're very active in baseball and hitting and pitch and working with several major baseball teams in the US. What was exciting this year for the first time is that our technology was used in the draft room to really impact selection and performance of various players. So we bring that deep expertise back to you to work with your industrial athletes and looking at their task analysis. So I really appreciate the opportunity to speak with you today and can't emphasize enough that as a frontline people with Flashlight, that you simply can download the app. You'll be able to see real-time analytics in the phone. And as part of attending this virtual summit and this presentation, we're offering that release to you with the Flashlight app with free Flashlight if you sign up through the QR code today. So we anticipate that'll be coming out in the next couple of weeks, and we're offering that free to participants. So really excited about that. What I'm going to do is switch to our video to give you a sense of what our video overlay looks like in real time. So as you can see, there's a bar along the bottom that shows where the person is in yellow and green. Oh, I lost it here. Let's see if we can bring it back up. Okay. Let's see if I can pause it before then and replay it. And it's giving you that gauge on the side to show you where they are in real time. So the overall risk for this task is 32. The upper body is 23, and it's a little riskier for the lower body is what we're seeing. Now the hand load was put in at 15 pounds, but if you were to increase the weight of these boxes, increase the frequency of the duration, you would see an increase in an overall risk. Another factor that we put in is when employees are created in a de-identified way, we estimate the height and weight. The height and weight of the person can factor into, say, for example, the overall back compression scores that we see, with the NIOSH. So I will play this one more time. Let's give people a preview. And I am going to then put up the QR code for you to sign up for your free subscription to Flashlight and the real-time risk analytics. And with that, I will also open it up to questions.
Also, down here in the left, QR code for this big big one that's on the screen. If you actually click the Scan Me, that's a button that will also work the same as scanning. So that'll also redirect to the correct site. So if anybody's struggling with the QR code scan, just click Scan Me in the bottom left. You'll see that it's a button and it'll redirect you. So don't feel like because you can't scan, you're not able to take advantage of this. Before we close up, I want to give everybody a chance to if you have a question, to type it in the chat really quick. But Lisa, I just want to say thank you for taking the time, the energy to present with us today. I think it's really interesting that everything you talked about and you've touched on basically every point that we're covering in this week's summit. And I think that really speaks to the quality of the technology. I just love seeing, future technology being used in a way that solves problems that exist today. So I think it's a really cool piece of technology. And again, I encourage everybody to check it out and please take advantage of, again, the free opportunity here. But yeah, if nobody has any questions, again, I just want to say, Lisa, thank you so much. Thank you to 3Motion AI for stepping up and being a sponsor for this as well. It really helped us be able to put on content like this and share it with everybody out there. So thank you.
Thank you. Thank you so much. Really appreciate the opportunity and appreciate all of you. So look forward to your feedback and on the technology when you have a chance to sign up.
Also, and before we go, two things. Tomorrow we have our next session is going to be at 12 p.m. Eastern by Osha Games. So it'll be a trivia presentation. And then Matt's session that Lisa was talking about earlier is also tomorrow at 3:30 p.m. Eastern. So be on the lookout for links for both of those. And again, if there's no other questions, we'll see you at the next session. Lisa, again, thank you so much for your time. And I wish everybody has a good day.
Thanks, everyone.